We published our data in Blood Advances recently, where we showed that there's impaired immune response to COVID-19 vaccination in patients with B-cell malignancies, particularly lymphomas, after standard of care CD19 CAR-T cell therapy. So we know that patients with hematologic malignancies are at increased risk of morbidity and mortality from COVID-19, and this is primarily because of the fact that patients have immunodeficiency because of the disease itself, and as well as because of the fact that they're treated with therapies that can lower patients' immune system. The immunogenicity of COVID-19 vaccines have been poor in patients who get B-cell depleting therapies such as rituximab or other B-cell depleting therapies in various conditions like lymphomas, leukemias, and myelomas. However, data on COVID-19 vaccine immunogenicity in patients with who received CD19-directed CAR-T cell therapy has not been well established. So in our research, we in our study, we sought to find out immunogenicity both from B-cell standpoint as well as T-cell standpoint in patients who get standard of care CAR-T cell therapy for lymphoma. So in our study, we looked at 18 patients with B-cell malignancies who were treated with CD19 CAR-T cell therapy. And we collected samples on these patients serially after first dose and second dose after the vaccination. We also had a healthy control group and who were also collected for blood samples with a similar time frame. In our study, we showed that only 1 out of 18 patients who received CAR-T cell therapy was able to have neutralization against SARS-CoV-2 or COVID-19 antigens. So only 1 out of 18 patients was able to mount an antibody response to demonstrate any significant neutralization. 17 out of 18 did not, which is a very, very low antibody response in patients who get CAR-T cell therapy and COVID vaccines. When we compared non-COVID antigens like flu, tetanus, Epstein-Barr virus, CMV, HSV, we were able to see good reciprocal titer or antibody levels in patients who have received CAR-T cell therapy. And the reciprocal titer or antibody level was not different from healthy controls. The suggestion here is that the patients who get CAR-T cell therapy and then have a novel antigen like a COVID vaccine, they're not able to mount an immune response against novel antigen. However, against previous antigen or recall antigens, they were able to mount an immune response. So it's just that they're not able to develop new immune responses, but their old immune response against common infections were retained in our data set. We're currently working on a report where we are going to report on T-cell immunogenicity. The paper is currently under review, but we did see good T-cell immunogenicity against COVID-19 vaccination in our 18 patients.